Hello everyone, I'm Carla Macias, host of Best Docs Network featuring Forest Park Medical Center right here in San Antonio, Texas. Our show features some of the best doctors in your area as well as one of the top medical facilities in Texas. Now let's start off today's show with one of the Forest Park doctors, bariatric surgeon Dr. Joan Pilger.
I was taking numerous medications prior to the surgery. I was taking medication to control the diabetes. I was taking insulin injections. I was taking medications for high blood pressure. I was taking medications for high cholesterol, medications for asthma-related issues to help me breathe because I was so heavy that my breathing was constricted. At the time, I really didn't know I was that sick, but once I went through the testing and found out I was that sick, that encouraged me to go ahead and make the decision to have the surgery.
James and I had a very good, serious discussion about which surgery would fit best in his situation. In his case, diabetes was a very prominent part of his medical situation, and we know the gastric bypass is more effective in treating diabetes, so we went in that direction. Speaking generally, we like to involve our patients in the decision process for surgery because we think that both the sleeve and the bypass are good options, and there's some differences between them. It's usually not a right or a wrong choice, but it's a balance of options that helps patients get the right fit for their life in the future.
After the surgery, my health has improved dramatically. I no longer take any prescription drugs for diabetes. I'm strong, I feel strong, feel happier.
James has shown to be a tremendously motivated, super pleasant individual to work with. He went through surgery without a hitch. And then what's super important is that after surgery, he's done everything that he could to get the most out of surgery as well. That means he stays with his vitamins, he stays with his follow-up visits, he exercises, and with all that, he's had outstanding weight loss, and what's more important is that he's had great health benefits too. James was on, I think it was 18 prescription medicines before he went into surgery. He's now down to just prescription eye drops and no other prescription meds at all. And so he's not only happy and healthy at a lower weight, but he's living the life that he really ought to get to have.
Dr. Pilger has been a major part of my life now. I don't feel I'm on this journey alone. Dr. Pilger's with me, and I owe everything to the work that he's done. I owe everything to the work I've done. So it's been a great journey.
It's a very exciting day, obviously, this partnership, because obviously Forest Park Medical Center believes in excellence. We pride ourselves on world-class service, and what better world-class organization is there than the Dallas Cowboys?
The cultures are so aligned. It's two groups, people, two teams that are really focused on excellence, have a passion for excellence. And it takes the same sort of things to make it work, because it's a team effort in the hospitals as well as on the field. You need the coaches, you need the players, the trainers, you need all the equipment staff here, and in the hospital, the nurses, the physicians, the technicians, all the people who maintain facilities all have to work together.
And really, if you think about what we do in healthcare, surgeries and the complexity of putting together a team, we honestly play the Super Bowl every single day, every patient. Our surgeons are quarterbacks, and they've got a team of great associates. Everybody's got to be the best and brightest at what they do, and together they can finish a game and score a big win for a patient. It's very much like football.
Our goal for Forest Park, Fort Worth, is really focused on excellence and innovation, and that's what the Cowboys are about. They have a strong tradition of really excelling at what they do, and that's what Forest Park does. And we think that is going to be really significant to the community and to their surrounding communities. And we think that not only will Cowboys fans love the Cowboys this year, they're going to love Forest Park.
And if you look at the Cowboys, it's excellence year after year. It's an awesome partnership. The excellence of the Cowboys and the outstanding patient care and customer service at Forest Park Medical Center, you couldn't ask for a better team.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Chris has a question for Dr. Gerald Greenfield. Why is it often difficult to define the source of pain in orthopedic injuries?
Orthopedic injuries involve more than just the skin. They may involve muscle, they may involve tendon, they may involve bone. Knowing the mechanism of the injury, we can surmise which tissue is injured, but just someone coming in saying, I have pain, it's not unusual to have referred pain, where someone may come in complaining of knee pain when in fact they have hip arthritis. They may complain of a leg pain when in fact the nerve that supplies that area is being compressed in their spine. So we have to look at the anatomy, we have to look at the tissue that could be damaged, and then with a combination of that plus knowledge over years of doing this, you can usually define what's going on. Once you've got that clinical picture, then you have to use a number of different X-ray or other techniques, even nerve blocks, to try to find out where exactly the pain generator is in all of those different tissues.
Forest Park Medical Center in San Antonio is located at the southeast corner of I-10 and 1604. And it is at just at a stunning location. It's at the beginning of the hill country. It sits upon a hill. The views from the rooms and the patios are breathtaking. The facility is like a five-star hotel, but with a hospital inside. And hospitals can be intimidating and scary places. And when you walk in, there's this unique smell, and the artwork is kind of takes your attention. The facility and the water features are very calming. The patient rooms are outstanding. They're appointed nicely. They're also comfortable for the patient's family if the family would like to stay with the patients. It's comfortable for the families as well. We have 16 VIP rooms, which are basically family rooms. It's a room inside a room where the patient's family can stay with them. The other piece that's really interesting is we've tried to take into account all of your senses when you come in, and everyone jokes about hospital food. Well, not at Forest Park Medical Center. We have a chef, and our facility and cafeteria and food service is outstanding. It is second to none. And we pride ourselves on that, on being different and unique. But we really do work to make sure that it is a calming environment and helps improve the healing of the patients. And it's reassuring for the families as well when they come there, that they know that they're not just part of a large quantity of patients, a large number. It's unique and specific for that patient, and the care and attention is given to the patients and to their families. I'm extremely excited to be a part of this project. It is, it's something to be part of a project from the ground up, and I've actually been here from the beginning with this project, and to see a difference that it's making in San Antonio and to see the excitement with the physicians. They're very excited about the new facility, about having a place where they can kind of call the shots. The nursing staff that we've hired to date is outstanding. They're looking forward to the ability to treat patients and deliver patient care. This type of facility is tailored to the needs of each individual community. It's not cookie cutter. It's what makes sense for the city of San Antonio and the physicians involved in this project. And it's been exciting, and I look forward to July and August coming along when we start doing our first cases and start treating patients and seeing the difference that we make in the patients' lives and their families' lives.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Zero Prostate Cancer is an organization that's helping spread the awareness of prostate cancer. Now up next, we're going to take a look at how Forest Park and some of their doctors help participate in this year's Zero Prostate Cancer Run.
has been amazing, and to all the folks here in San Antonio that have come out.
And in particular, we've had great support from Forest Park. They've been a wonderful partner in this event. Just can't say enough good things about them. If you find prostate cancer early, you're not going to die from prostate cancer. There's a good chance you're going to do really, really well.
Eating eggs for breakfast not only tastes good, but they help to slim you down too. Each egg you eat has 6 grams of protein, but only 72 calories. Dr. Joan Meany is a urologist here in the San Antonio area. Now let's hear her methods on practicing medicine.
I know a lot of people, are afraid to come see a urologist because these are very delicate issues and sensitive issues, and it's hard to talk about them. So I want to be able to make my patients comfortable so that way they can bring in whatever concerns they have and get a good communication with me so that we can look at all the factors and get the treatment that they need, bring them back to health. Over the years in my career, I've seen how hospitals have gone from being directed by the physicians, the doctors that work there, to being directed by big corporations, often not even listening to what the doctors need. Forest Park is a different type of development where actually the physicians are able to communicate and get the needs met as we used to be able to do 15 or 20 years ago.
I had a lot of input on how I wanted to take care of my patients, but now I feel like I have a lot more input on how our hospital approaches taking care of patients, and being able to influence not only what I'm doing, but being able to influence the receptionists who come in, the staff who process patients in, the transport staff, but all of us to make this, we're all working for the same goal, and it's nice to know that I'm able to have a partner.
The doctors are able to direct the care. It's a beautiful facility. It's going to give the best care in this region. I am so looking forward to being part of the Forest Park Medical Center here in San Antonio.
I know that if I was to get sick and need hospitalization, I know which hospital I would want to go to, and that would be Forest Park.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
By heading over to bestdocsnetwork.com, clicking on San Antonio under the Our Doctors tab, there you can watch hundreds of other videos on today's current health topics and procedures. Now, one of those doctors you can find on our website is San Antonio plastic surgeon Dr. Peter Fisher. Now let's listen as Dr. Fisher discusses post-bariatric surgery body contouring.
My issue that I sought out surgery for is that I have a 200-pound weight loss, and that leaves your body very disfigured. If you need a mommy makeover or a tummy tuck or a breast lift, you could probably go locally and find a competent surgeon. I looked in Atlanta for surgeons, and there was none I was convinced in Atlanta that were true massive weight loss specialists. I found Dr. Fisher, and I did a consult with him. I had looked on his website, saw that he did have a specialty with the massive weight loss patients. But what really sealed the deal is when I talked to him. And when you talk to him, he gives you so much time and attention. He answered all my questions very thoroughly and thoughtfully, and with me in mind.
Melanie came in specifically because she felt like I could do a little bit more with her thighs and calves. She had had a gastric sleeve, had lost close to 200 pounds. At the initial consultation, I felt like we could get all the procedures that she wanted done in 2 operative sequences. And these included a lower body lift, which incorporates 5 different aspects, which is a tummy tuck, a Mons lift, a very strong lateral thigh lift, a buttock lift, and also the ability to do a buttock augmentation and hip augmentation.
Having the massive weight loss plastics afterwards is truly a way to complete your weight loss journey and feel good about yourself, to actually have a body you can feel good about. I wore my first bikini 6 weeks ago on a beach. I had never worn a bikini in my life, and I was so happy. And it's just a feeling you could not imagine. To be able to do that for your first time in your life, it's freedom.
The ideal candidate for this procedure is someone who's really lost a lot of weight and is really unhappy with their body. They have excess skin in areas that cause them problems. It's really unsightly, and they're just not happy with the way they look.
All that contributed to the process was the good sense to choose a doctor like Dr. Fisher.
Did you know the staff at Forest Park Medical Center has an outstanding commitment to their communities? They support health-related causes in addition to providing healthcare services to victims of natural disasters. They are active participants with the North Texas Turkey Trot, Toys for Tots, and Brian's House, to name a few.
This is Operation Once in a Lifetime's annual Toys for Troops drive. What we do is we raise toys for military families that need a little assistance during the holidays. These military families can range from active duty Army, Navy, Air Force, Marines to veterans. And not every military family is in need this holiday season, but for those that are, we're trying to help them just all over the U.S., when we can.
This is our second year to be with Toys for Troops. Several of our staff members have family members in the military. And of course, we have several veterans on staff. On the holidays, we like to serve our staff food. We get the directors involved in that to serve the staff. And it's provided complimentary for the staff, for anybody in the community that wants to come in, and for today for the soldiers that were coming in with us today. It was a great honor to be able to serve them. I think the great thing today showed was the community involvement and the sponsorship and the involvement with the Cowboys. The Cowboys came today, the cheerleaders were here. The mayor from Frisco came in today. Some of the community came in. Our staff were present. They brought their families in. So again, it goes to great community, great families, and great leadership, I think, throughout the community of Frisco.
Most of these toys collected today are going to be going down to Fort Hood, which is one of the largest military installations in the world. We have hundreds of military families on waiting lists needing help. Forest Park Medical Center has been a big support for not just Operation Once in a Lifetime in the military, but the Frisco community in general, their Kids Surgical Center, and not just here in Frisco, but even their Fort Worth location helping us out. And we honestly would not have been able to help as many families if it wasn't for them helping us this year.
I think one of the things we consistently strive to be is involved and touchable and visible. So I think today was one of those events where the staff are very visible, they're very involved in what we do. Leadership is not behind walls, we're very accessible to our team. And I think with our turkey trot earlier, everybody volunteers, gets involved, they enjoy working at somewhere that can give back and has the ability to give back. and it draws the community into it to make it a true community hospital.
For more information on any of the doctors you've seen on today's show, head over to bestdocsnetwork.com. Now up next, let's listen as Dr. Jillian Cho discusses breast cancer with one of her patients.
Back in September of 2013, I scheduled an annual physical. Everything looked great as far as the blood work. The nurse practitioner said, I looked healthy. She felt a lump in my right breast. She wanted me to get it checked out. So I was referred to the Aurora Center. Dr. Cho was the doctor that was assigned to me. She wanted to do an MRI. After the MRI, she said, well, that still looks a little suspicious, so I want to do a biopsy. So when she did the biopsy, that's when I found out that I had breast cancer in my breast, and also cancer cells were found in one of my lymph nodes.
Breast cancer is a systemic problem. We have, breast surgeons, we have radiologists, we have medical oncologists, all under one roof and work toward an early detection. And if the cancer was not diagnosed early for some reason, we would find the best way to assess what has to be done to reduce the impact of the therapy, to reduce the side effects, and to give the patient the best chance of cure with the least long-term side effect.
The first 4 rounds of chemo worked so well that instead of only having the option of a mastectomy, and also because of the BRCA gene test that they ran, I'm not a carrier, but both of those things together, I was blessed to have the choice of a mastectomy or a lumpectomy, and I chose the lumpectomy. Today I'm feeling good, thankful to only have 6 more treatments left, 1 tomorrow. I had an MRI recently. I've also had a mammogram and everything looked well. Dr. Cho was very pleased with that. I'm really thankful for Dr. Cho. She's very thorough. She's always in a good mood, always happy, always very energetic. And so I really appreciate her as a doctor.
Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
Hi, I'm Dr. Troy Deal here with Forest Park Medical Center to discuss high ankle sprains. So what exactly is a high ankle sprain? A high ankle sprain is an injury that involves the twisting of the ankle during a contact sport or a non-contact sport that can result in a very significant injury, and one even requiring extensive treatment and recovery. So the best way that we are able to determine the difference between what you consider what we commonly call an ankle sprain versus a high ankle sprain is really the mechanism of injury. How did the athlete or the patient actually injure it? And so it's the history in itself of how the injury occurred. In addition, it's also looking at whether symptoms that may be associated with their injury or other signs, whether it be swelling, bruising, the inability to control the ankle, or just pain associated with a certain part of the ankle, all help guide us on exactly what is injured during this type of injury. Now we talk about the treatment of a high ankle sprain, and the important part about it is recognizing that when somebody does present with an ankle sprain, that we do see that they have an associated high ankle sprain. It sounds like they'd all be the same, but actually the high ankle sprain is a more significant injury and requires a longer treatment plan, and a lot of times may require surgical intervention as part of its true treatment. So when we talk about what is the length of recovery for a high ankle sprain, it does, again, relate to the grade of injury and or other associated injuries involved in the ankle sprain. It can be a simple process in the sense that a few weeks, the patient, if it is a grade 1 or 2 injury, may be back playing sport. However, I usually tell patients that this is definitely a longer process, and in my mind, it's usually 6 weeks is minimum. It can be up to 3 months, depending if there is any surgical intervention planned for the treatment of the injury. I'm Dr. Troy Deal with Forest Park Medical Center. Thank you very much.
Victor has a question for Dr. Saltstein. How common is prostate cancer?
There's a saying that if you live long enough, you're going to get it, okay? I think the ratio in the United States is 1 out of every 6 men will develop prostate cancer in their lifetime. Currently, probably, like I said, there's going to be anywhere from 250,000, 260,000 men in the United States diagnosed with prostate cancer this year.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine, Forest Park Medical Center. And that'll wrap up another episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. For more information on any of these doctors, head over to bestdocsnetwork.com. Got any questions or comments? Please feel free to email us at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.